Hi, I'm Dr. Pauline Stolzner. I have been asked to do a short presentation of a psychiatric condition, and today I'm going to do that on anxiety. This is a greatly summarized form, so anxiety is a much more in-depth process, but for the sake of this presentation, it has been shortened. Let us begin. An understanding of anxiety and anxiety defense mechanisms is basic to the practice of psychiatric nursing. One of the greatest contributions to psychiatric nursing by Hildegard Paplau was the operational definition of the 4 levels of anxiety and the recommendation of appropriate interventions to treat each level of anxiety. Anxiety is a feeling of apprehension or uneasiness and uncertainty from a real or a perceived threat whose actual source is unknown or unrecognized. Fear is a reaction to a specific danger, but the body reacts in similar ways. Normal anxiety is necessary for survival. For instance, it provides energy for studying for an exam, and having anxiety before an exam is acute. It's before a performance. Chronic is someone who has lived with it for a long time, typically due to a traumatic event in their past. Anxiety can be normal, healthy life force that is necessary for the survival of a person because it provides the energy needed to carry out tasks involved in living and striving towards goals like studying for a test or a job interview. It is acute. Now, it could be because of imminent loss or a change that threatens an individual's sense of security, like a performance or a patient preparing for surgery, or even a death of a loved one. But all of this can create or move towards a crisis situation. Now, chronic anxiety can be adaptive or maladaptive, but the person has lived with this for a long time. The physiological response of anxiety is more often associated with muscle tension and vigilance in preparation for future danger with cautions or avoidant behaviors. With fear, more often the body reacts with surges of autonomic arousal necessary for fight or flight, thoughts of immediate danger, and escape behaviors. Anxiety affects us at a deeper level than does fear. Anxiety invades the central core of the personality. It erodes the individual feelings of self-esteem and personal worth that contribute to a sense of being fully human. Research has identified the brain circuitry for anxiety and fear are closely related and at times even identical.
When the unexpected is staring you in the face, fear is there to keep you safe. With speed and wisdom, fear assesses the situation and settles your nerves in his own special way. He's got this. Thank you, fear. Get to know all your emotions.
Days could determine the next 4 years of our lives. I think that's overstating things a bit.
Oh, no. Joy is so old school.
What? Look, we all have a job to do. You make Riley happy. Sadness makes her sad. Fear protects her from the scary stuff she can see. And my job is to protect her from the scary stuff she can't see. I plan for the future.
Anxiety disorders are most likely caused by a complex interaction of biological, psychological, and environmental factors. Biologic factors such as genetic vulnerability may interact with stress or trauma to trigger pathological anxiety states in some individuals. Examples include phobias or panic attacks. Traumatic life events, witnessing spousal abuse or child abuse or muggings, sexual abuse. There's psychosocial factors and sociocultural factors are all etiologically significant. Normal anxiety provides the energy needed to carry out the tasks involved in living and striving towards goals, motivates people to make and survive changes, and prompts constructive behaviors such as studying for an examination, being on time for a job interview, preparing for a presentation, and working towards a promotion. Acute anxiety is a normal and expected response to stress. but pathological anxiety occurs with an intensity that is out of proportion to the threat. It persists after the threat is resolved and becomes generalized to benign situations, or even occurs in the complete absence of a stressor. This slide is the characteristics of anxiety and their levels. You can see that having mild anxiety can actually be helpful when working towards a goal. But you can also see the more significant the anxiety becomes, the less helpful and even hinders an individual's abilities. When an individual is faced with a situation that triggers high levels of anxiety, that person may become more rigid in the use of defense mechanisms and may revert to using less mature defenses. The degree of distortion of reality and disruption in interpersonal relationships determines if the use of defense mechanisms is adaptive, healthy, or maladaptive, unhealthy. All defense mechanisms can be used in both ways, healthy and unhealthy ways, with the exception of sublimation and altruism, which are considered very healthy coping mechanisms. Healthy defense mechanisms are the most mature and healthy. The defense mechanism of repression is the foundation of all defense mechanisms that are used on an unconscious level. But most people use a variety of defense mechanisms, but not always at the same level. Whether the use of defense mechanisms is adaptive or maladaptive is determined for the most part, by their frequency, intensity, and duration of use. Okay, so that brings us to pharmacologic therapies. So benzodiazepines should be used short-term use only, as they can be very addictive. And the patient would be instructed not to drive, no alcohol or other central nervous system depressants. They should avoid operating dangerous equipment. It may exacerbate respiratory conditions. It has an increased risk of pneumonia, can cause cognitive impairment, and like I was saying before, there is big problems with abuse and addiction with the benzodiazepines. So short-term use only. Buspirone is pretty specific to anxiety disorders, and that's its main use and purpose. In addition to SSRIs, SNRIs, and tricyclic antidepressants being prescribed for anxiety, they are also used for multiple comorbid conditions such as depression, tic disorders, and even pain. MAOIs is really used as a very last resort for significantly treatment-resistant conditions. That's mainly because the dietary restrictions with this it's really high, and a lot of patients have a hard time following those dietary restrictions. Here's a chart of the different medications that are used for anxiety disorders and their recommended starting doses to treat the condition. I always like to start with non-pharmacologic treatments for anxiety disorders, depending on the severity. Of course, if a patient is having severe panic attacks daily, I'm not going to tell them to go meditate and I'll see you in the next month. But for the mild to moderate cases, I will try these non-pharmacologic treatments first with close follow-up.